Okay, so the first step to performing a urinalysis is catching your sample. Many times you'll have to obtain it via cystocentesis, but in this case we're going to obtain a free catch sample first. So we'll go ahead and get started. You are going to need some kind of urine catching device. In this case we have this nifty little pole with a little dish attached. It's a one-time use dish, but lots of different things can work for this. So we'll go ahead and get our patient. So we got our sample, so we'll go ahead and take this back to the lab. Okay, so now that we have our urine collected and we're back inside in the lab, we're going to go ahead and we're going to run a urinalysis. So the first things we're going to look at kind of subjectively is we're going to look at a couple different things. So we're going to look at the color of the urine, we're going to look at the clarity, we're going to look at the concentration, the urine specific gravity. We're going to note any odor, and we're also going to look for any signs of foam. And so we'll kind of go through what each thing means as we go ahead and get started. The other thing I want to make sure I have kind of ready, at least for me, this is for when I record my urine chemistry readings. So we're going to look at blood and hemoglobin within the urine. We're going to look for bilirubin, urobilinogen, ketones, glucose, protein, leukocytes, the pH of the urine, and then the urine specific gravity. And we're going to make sure we record all these things for our complete urinalysis. Okay, so first off, I'm going to look at the color of the urine. So I would call this urine, I'm going to call it a yellow to a dark yellow. Yeah, I'll probably just call it like a yellow. You know, it looks like fairly normal colored urine to me. It's not too light, not too concentrated, not too dilute, not too concentrated. So we'll make sure we record that. So I'm going to write yellow color. The next thing I'm going to look at is I'm going to look at the clarity of the urine. So I kind of like to hold it up to the light and just kind of see, is it turbid? Is it cloudy? Do I see, you know, actual sediment floating around there? Do I see, you know, sometimes when there's lots of urinary crystals, sometimes you can see kind of a glimmer. But yeah, I don't really see any obvious sediment floating around. I don't see any cloudiness. I'm going to call this urine clear. So we'll write that, clear. So as I was bringing the urine in and I was putting it into the syringe, I did kind of smell the urine. I just wanted to make sure it doesn't smell overly malodorous. It smelled like pretty normal standard urine. So if a urine was particularly odorous, sometimes that can tell us that there's lots of bacteria in the urine, and that could be a sign of a urinary tract infection. So not the only thing you should ever use to diagnose a urinary tract infection, but certainly a good thing to know for sure. And then you'd also want to look for any signs of foam. And I don't think I see any. It looks pretty clear to me. So certain animals can have foam in the urine, such as horses. That's a pretty common finding. Can indicate, I believe, something to do with protein. So anyways, we'll go ahead and continue. So now that we've noted kind of the physical properties of our urine, the next thing we're going to do is we're going to go ahead and start our chemistry reading on our urine.
You just want to have let us know that that's off for you. And then we'll go that way.
Okay, so I am going to take a paper towel. Oh, before we go too much further, the next thing I'm going to do is I'm going to go ahead and get a urine specific gravity reading. So we're going to put a single drop onto our refractometer. And we're going to look at it. And basically we're reading where the white meets the blue. And the urine specific gravity chart is on the right hand side. The left hand side is a side that doesn't apply to us right now, but the left hand side measures serum total protein. So we're looking at the right hand side. The urine specific gravity for this urine is 1040. So we want to make sure we record that. So 1.0.040 is our USG. And then we're going to take a Kim wipe, make sure we wipe down our refractometer. Okay, set that aside. Okay, and now for the kind of the chemical or chemistry reading of this. So if you're running a urine dipstick, it usually comes in a bottle like this. This little colorful chart here is essentially like our key. So it's our reference. We're gonna essentially line this up right here, and we're gonna read and we're gonna record our readings as follows. So we'll go ahead and get started with that. So you wanna take out a single strip. There's that. And you wanna put a single drop onto each strip. Or onto each square, excuse me. Okay. We're then going to lightly tap off excess urine, and then we're going to line it up to our reference key here, and we're going to read. Okay. So we're kind of holding it up like this here. Hopefully you can see that okay. And we're going to read those colors as they correspond to our key. So the first thing we're looking at is we're looking at the blood and hemoglobin in the urine. So because it matches up with the negative yellow, I'm going to call that, we're looking right here, I'm going to call that a negative. So you would write negative. If there were any signs of blood or hemoglobin in the urine, you would write, erythrocytes per microliter. Excuse me, it took me a second to remember that. And the next thing we're going to go to is we're going to go down to the bilirubin. So the bilirubin, I'm going to call that a negative as well. So we're going to write bilirubin negative. You would refer to that as milligrams per deciliter if there was some bilirubin in the urine. Urobilinogen. I'm also going to call that negative. It doesn't show any signs of the pink colors of the positive, so we're going to write urobilinogen negative. Again, you would note that in milligrams per deciliter if there was some. Ketones also looks to be negative as well. So we're looking right here. So ketones negative. Again, you would note that in milligrams per deciliter if there was any signs of it. Glucose. So glucose is right here. I'm going to say that that's a negative as well. Again, noted in milligrams per deciliter, so glucose negative. Protein. Protein. So go ahead and show you here. So this urine actually has, it's not quite the negative color. It's kind of a light green. It matches up with this trace here. So I'm going to actually write protein trace. So trace amounts present in the urine. If it had any more than trace, we would note it in milligrams per deciliter again. So sometimes that can indicate protein shouldn't normally be present in urine. So sometimes that can indicate some kind of kidney dysfunction. We will definitely, make a note of that for sure, and be sure to tell our doctor. Leukocytes. So leukocytes right here, that's white blood cells in the urine. Sometimes that can indicate, in higher amounts, that can indicate urinary tract infection or inflammation. So that is negative. So no signs of leukocytes in the urine. pH, so kind of the acidity level of the urine. So I'm going to call this, I'm going to move this up. It matches best with a 7. So we're going to call it a pH of 7. Specific gravity. Again, we already noted that, so 1040. 1.040 USG. Okay, great. We'll set that aside. So kind of your finished chemistry reading, urine dipstick reading should look kind of like this. So negative blood hemoglobin, negative bilirubin. Blood can be present in urine from, it can either be like artifact from like a cystocentesis, it could be there because there's a urinary tract infection, it can be there because of inflammation. Bilirubin, bilirubin and urobilinogen both, I believe, correlate with liver. Those are negative. Ketones, glucose. If there's glucose present in the urine, sometimes that can mean the dog is diabetic. Sometimes. Protein kind of relates to kidneys. Leukocytes kind of relate to white blood cells in the urine. pH, acidity, and then specific gravity is kind of urine concentration. Okay, so the final thing we're going to do is for this part of the video is we're going to go ahead and we're going to take our urine sample and we're going to spin some down. And the reason we spin it down is we basically look at the sediment underneath the microscope and we can see the actual cytology of the urine. So we'll go ahead and do that. So we want to make sure we have a labeled tube with our patient name. We want to make sure it's a sterile tube. We want to make sure that we put this in, you know, fairly sterilely. You want to hold it up. Put it in just like so. You want to put your lid on. You'd want to be especially careful if this was a sterile sample. This is a free catch sample, but you should always treat it the same. We'll go ahead and we'll put it in our centrifuge and we're going to spin it down. Okay, and so you want to make sure, ignore that beep, you want to make sure you put it at 2000 RPM. So that's kind of the speed at which we spin the urine down, and then you want to run this for about 5 to 10 minutes. And now we wait. Okay, so now that our urine is done spinning, the next thing we're going to do is we're going to go ahead and prepare it for cytology reading. So go ahead and grab my transfer pipette, and what I'm going to do is I'm going to very carefully take off the excess urine off the top here. And we're doing this carefully because we don't want to disturb the sediment at the bottom. That's actually what we want to read. Okay. So the next thing we're going to do is we're just going to kind of flick the bottom of the test tube. And that just kind of mixes up the sediment. We're then going to take a single drop and we're going to put it on a microscope slide. We're then going to apply a cover slip very carefully. So that would be an example of how to do an unstained preparation. We're then going to move on and we're going to make a stained urine sediment preparation too. So what we're going to do is we're going to add a single drop of our urine sediment stain. Just one. We're going to do kind of the same thing. We're just going to kind of flick, and we do this so it mixes up. And then we're just going to take a drop of that, and we're going to put it on the other microscope slide we have here. And then we're going to go ahead and we're going to put a cover slip on. Okay, so we now have two separate samples. We're going to go ahead and read our stained sample. You can actually read both. The stained sample can be a little bit easier sometimes for identifying things. but either is fine. Usually we prepare one of both. It just kind of depends on what doctor prefers what. Often they will read both though. So the next thing we're going to do is we're going to look at it underneath the microscope. Okay, so now that our urine sample is ready to read, we're going to go ahead and read it underneath the microscope. So the first thing we want to start off with is, for the sake of this video, we're going to read the stained sample that we have here. You should read both, it's always helpful. Okay, so let's go ahead and put our slide on the microscope here. And just like every other cytology, we're going to read it in kind of a sort of a zigzag pattern. So I'd start at the top, go all the way down, go slightly over and go all the way back up, and then slightly over, all the way back down, and then so. So you do this because you want to make sure you read the entire slide. You never want to just read it partially. You want to make sure you read the whole thing. And you'd also want to not go back over something you've already read. So we'll do it in this fashion. Let's go ahead and get started. Okay, so we're going to want to start off in the lowest scanning objective lens here. So we're going to go ahead and start at the very top here, just work our way down. Let's get all focused here, and then I'm going to move up to our 10 power. And I'm then going to move up to our 40 power. This is where I'm going to do most of my scanning. The last thing we're going to do is we're going to change to our 100 power objective, our oil. This is the place where you can best see the bacteria, but this 40 power is good for just finding most common cells. So we'll go ahead, we're looking for any signs of cells that we'd find in urine that shouldn't be there, or should be there sometimes. And we'll look for things like casts, we'll look for crystals, white blood cells, red blood cells, bacteria, different kinds of bacteria, that kind of thing. So any signs of urinary tract infection or any other abnormalities like crystalluria or anything like that. Okay, I'm going to move over slightly and I'm going to head back up the slide. So far I've actually found one single struvite crystal. This dog actually has a history of crystalluria and urinary tract infections, so it's a good thing to know. One crystal is not usually overly concerning, but we're definitely going to have a veterinarian look at it. And normally what I would do is if I saw any crystal or anything that I feel should be looked at, I will stop, pause, make sure I focus on the thing that I want to look at, and then I'll have a veterinarian come over and check it out. But I will, for now, make a note, one struvite per high power field. So I will continue to look for struvites as well as anything else. I do see one other, but again, just one per high power field here. And I'm seeing just a little bit of debris, nothing cellular, I don't think. Sometimes that can be common with especially free catch samples. And actually I do see an air bubble, and I know it's an air bubble. It's much too large to be any sort of cell, and it doesn't have a nucleus or resemble a cell really otherwise. So another large air bubble here. I'm going to go over and then go back up the slide again. I don't think I'm not seeing any more crystal-like things so far, which is good. I do see one additional, what appears to be another struvite crystal, I believe. But again, just this one per high power field, and they seem to be pretty rare. Kind of on our last row here. Okay. So the next thing I'm going to do is I'm actually we're gonna go ahead and put it on the 100 power, and we're just going to do a scan for bacteria as well. I don't think I saw anything that was suspicious for bacteria, but we're going to go ahead. It's certainly not going to hurt. So we'll do that. So we're going to make sure we put a little oil. We're going to go ahead and put it on the 100 power objective. And we're just going to do the exact same type of scan that we just did. Okay, so now that we've completed, we're going to go ahead and we're going to clean up our microscope. So we're going to take off our microscope slide. I'm going to discard that. And especially because we used oil, we want to make sure that we clean off the oil off the lens. Just kind of do a general wipe down. We're going to use a little optical lens cleaner. Kind of wipe up a little bit. I'm going to put everything back in its place. Okay, so I'm going to kind of record what I feel like I saw. I'm going to finish our notes here. So we did note already that we saw, we're going to call it 1 struvite per high power field. And that seemed to only occur every, I think, about 3 high power fields per the entire slide. So the next thing we would absolutely have is we'd have a veterinarian come over and look. So I would basically go back and I would focus on one of the struvites or problems of concern that I thought I saw, and I definitely have a veterinarian look at it, so that way we know that we're looking at the correct thing. All right, and so now that we have our notes, 1 struvite per high power field, we have the rest of our urinalysis. We can now present it to the veterinarian. Okay, so now that we've read our urinalysis, the next thing we're going to do is we're going to go over the commonly seen things that you would see in a urinalysis. And I'll just kind of go over things such as red blood cells, white blood cells, and casts, and as well as crystals. So the first example I'm going to show you is red blood cells. And I'll kind of bring the camera over here so we can see our photo here. Okay. So this is an example of red blood cells. So I'll show you exactly what I'm pointing at. So these little small red things are the red blood cells, the ones that are in most abundance here. So why would we see red blood cells in urine? So red blood cells literally means there's blood in the urine, hematuria. So this can be present for a lot of reasons. It can be present from inflammation. It can be present from infection. It can be present from artifact, from maybe your cystocentesis, maybe you damaged or hurt the bladder wall while performing a cysto. Lots of different reasons, but the main reasons they're going to be present are either infection, inflammation, and artifact. So that's kind of an explanation of why red blood cells would be present in the urine. Their presence alone do not 100% merit a urinary tract infection. If they were just present, it was the only thing present there, no bacteria, no white blood cells, you would consider it a cystitis, inflammation of the bladder. And you could account the red blood cells being present in the urine due to inflammation rather than infection. If there were white blood cells present, red blood cells present, you're more likely dealing with a urinary tract infection. And that is kind of the doctor's call, but your best thing is just to record what you see and report it to the doctor. Okay, so we're gonna go over a few more things here. So, I'm going to take this off. A few things we're going to go over here. Okay, our next fun thing that we're going to go over is we're going to go over white blood cells and specific types of bacteria in the urine. So, what we see here, I'll show you what our white blood cells are. So, these guys right here are considered white blood cells. So they're larger than your red blood cells, larger than bacteria. They often are a circular shape, but they can be somewhat ununiform. Sometimes they look like one of these guys up here. But these guys are usually present in response to an infection. So your occasional rare white blood cell in urine is not totally abnormal. However, if you saw a number such as this, especially in conjunction with bacteria that you also see in this, I would probably consider this, I would suspect that this would be a urinary tract infection. This is just too much bacteria and too much white blood cells present in the urine to be considered normal. So the bacilli, so this is rod-shaped bacteria. That is a particular type of bacteria that you may or may not see. You can also see cocci, spherical-shaped bacteria in urine as well. So rod-shaped bacteria are these little dudes right here. They're the little rods, and so those can usually, or almost always, an indication of infection. Usually not normally present in urine. So we can consider the combination of white blood cells and bacteria in this urine most likely a urinary tract infection. But again, that's the doctor's call, but we just kind of report what we see. Okay, we'll move down. Okay, so we have a couple pretty things we're looking at here. So this is an example of cocci bacteria. So you will see often cocci in clusters, but not always. The clusters or chains that you see here can sometimes be a giveaway that it is true bacteria and you're not seeing, some kind of other debris in the urine. The amount of cocci that you're seeing here in this urine sample, I would consider this probably too abundant to be normal. Again, bacteria is not usually present in urine, so I would probably suspect that this is due to a urinary tract infection. Again, doctor's call. Okay, so the next thing we're going to discuss is we're going to discuss urinary crystals. I'm going to kind of go over some of the more common signs here. Common things you'll see. So struvite crystal is a very common crystal you will see. They often have a very particular appearance. They look kind of like a coffin. This is one you will probably not see very often. This is ammonium urate. And we also have calcium oxalate monohydrate and dihydrate as well. Sometimes you'll see drug-specific urinary crystals, such as if a dog had a drug toxicity, such as antifreeze or different kinds of drugs. Sometimes you'll see different types of urinary crystals. Not super common, but they can occur. Bilirubin crystals are usually due to liver dysfunction. So these are these interesting looking guys here. Not super common, but certainly can be seen. Another thing you can possibly see in a urinalysis that would be pretty concerning are these. You can see particular types of cells. And sometimes, cells can mean some pretty serious stuff. So in this case, if you were to see something like this, this is what we call a transitional cell carcinoma. So if you were to see these distinct, they often come in little groups like this. You'll see a darker center and kind of a lighter out center. Transitional cell carcinoma generally means these are malignant cells. So they shed from the bladder, and usually it means some sort of malignancy. So there's a particular type of malignancy that comes to mind. It's called transitional cell carcinoma, TCC. It is a form of bladder cancer. Okay, so we'll go ahead and we'll move on to our different types of casts that we have here. So there are several different types of casts. The one thing that I like to keep in mind about casts is casts occur usually from renal degradation. So something is going wrong with the renal system, and therefore it's shedding casts from its tubes. So white blood cell casts can be present from severe urinary tract infection. Chronic renal failure can occur from waxy or broad casts, which I actually don't have a photo of right here, but that's okay. Acute renal failure, you can often see highline casts right here, and kind of mixed casts as well. So that's just kind of like the more common types of casts. Casts are not a super common occurrence, but you certainly can see them. Again, usually related to kidney function, usually some kind of kidney dysfunction. So usually these particular types of casts will slough from the ureters in the renal system.